How can you tell if you have a healthy voice? Dr. Paul Bryson is a laryngologist at the Cleveland Clinic. He also runs the Voice Center.
I think voice is one of those things that we take for granted until it's not working the way we want. But teaching, sales, customer service, people that work in call centers or scheduling areas where there's a lot of, even if it's not face-to-face, you still have a pretty high vocal load where you have to talk to clients and customers and patients on a daily basis. A healthy voice is a voice that, it sounds like you. It hasn't changed recently. It's a voice that you're able to use it for your work, and you don't have to think about it. It's performing in the way that you would expect. It's not fatiguing. It's not sore. It has the right loudness and sort of pitch agility that you would expect it to have over the course of your workday.
What are some red flags when it comes to your voice?
If there's a change, if it's sore, if it doesn't get better in a time frame that you would typically expect an upper respiratory infection or like laryngitis, those would be the things that I'd worry about. So specifically, anything that lingers on after 2 weeks, I start to get a little bit concerned. Anything that goes longer than a month definitely is not. I wouldn't consider that to be a normal thing. Most of the time, it's just overuse or an upper respiratory infection with laryngitis. That would be the most common thing. And so you can get some inflammation and swelling in the vocal cords. And that's usually when the voice will get hoarse or rough. And usually with rest or some recuperation, you'll get back to a more normal spot. Specifically, an ear, nose, and throat doctor or an otolaryngologist, like I said, we're called. We have some scopes and things like that that can look specifically at the vocal cords. And that's really where the power is. Because if you're hoarse, sometimes other providers don't have the training or the equipment to take a look at the vocal cords. And that's where I think sometimes there can be a delay in diagnosis or at least some mystery as to what is going on. We do see vocal cord cancer. In general, it's pretty uncommon. But if you have risk factors, smoking, heavy alcohol use, history of other cancers in the family, those are all red flags. Sometimes, neglect, where your voice has maybe changed and it's just been hoarse for months. Those are red flags where you should come in and see a ear, nose, and throat doctor or an otolaryngologist, as we're called. Listen to your voice, listen to your instincts. It's always better to take a look and see than it is to just go around not knowing and being concerned.
For Fox 8, I'm Dr. Marc.
Dr. Marc is sponsored by the Cleveland Clinic.